Hello again here. So we continue our live studio sessions with the experts, the interview with the experts. And unfortunately, this is our last interview for this Congress. However, I think it is very important topic that we are going to discuss, and I am very happy and honored to have next to me Professor Alexander Jakovljevic from Belgrade University and Professor Alexei Godin from Nan University.
Correct.
Yes, happy to have you here, and we are going to talk about exploring the link between systemic health and endodontic treatment. So I have first question to you, Alexander. Your meta-analysis, I'm referring to 2023, shows a reduction in systemic inflammation after the root canal treatment. In simple terms, why is this a breakthrough out for endodontics?
First of all, it's my pleasure to be here, and thank you so much for inviting me to participate in live studio, and with a great friend actually. And I would like to congratulate on a wonderful event. So, as a president of SFEs, it's great, yeah, just to have like a high bar on the next ones, yeah. Um, Excellent choose of topic. I really believe it's excellent choose of topic. And if you ask me about the collaborative work we made with the colleagues all around the world, I think that that meta-analysis was something really that we needed in endo-scientific aspect of this topic because, it was a summertime when I was writing. I was on a vacation with a month with the family, and during in between all things, I was thinking, what do we need to prove more that endo treatment is really, really, really important,
Yes.
really important.
Yes.
So I was reviewing the literature and analyze. There were some studies that already shown that some of mediators could be potentially decreased,
Yeah.
but those were primary studies. We didn't have such high level of evidence, which is very important when we are writing guidelines. And I realized, let me check if I could summarize those data and to see what would I get. When I saw the results, I was really amazed by the fact that we actually shown that some really important mediator as high sensitive CRP, C-reactive protein, that is actually the mediator of acute phase of inflammation, which we are dealing with, could be significantly reduced 6 and 12 months after the endodontic treatment. So you know that we were all time fighting with the things that is it worth to do treatment? Could it be good in terms of decreasing the inflammation? And now we finally got the high level evidence proof. Yeah, that's the important thing. And I'm so happy because it was collaborative work with the colleagues from all around the world, experts who actually prove that it is worth it,
Important. Yeah.
That's important.
Yes. Alexei, from your clinical perspective, how do you see endodontics moving from a tooth saving specialty towards influencing the whole body health?
It's a good question. I think, thank you for the question. I think that endodontics shouldn't be an isolated specialty. Even if we focus on the root canal system, periapical lesion, there is a patient beyond the tooth. And we need to collaborate with physicians, with our colleagues, because the tooth is a part of the oral health.
Yeah.
So,
Organ.
yeah.
Yeah. So let's continue. Clinical meaning, yes? Your study showed that after root canal treatment, level of certain inflammation signals in the body went down. Yep. For example, markers linked to heart health and immune response. Why should this matter to dentists and the patients?
As Alexis said, we are just one branch of a medicine, and I think that in general we should teach our students that they need to think like a real doctors, not only a pure dentist,
Yes.
because we need to realize that everything we are doing in our mouth have percussion on a repercussion of our
Yes.
body. It's really important, you know. If we could help to reduce inflammation by treating teeth, it's magnificent, you know. So we could help to decrease the percentage or prevalence of autoimmune disease, some other cardiovascular events, diabetes, etc., which is very, very, very important. So we are giving our best to help to promote oral health as a part of a general health. So it's really time that we start to promote the idea about endodontic medicine as something which is very, very, really important. Yeah, that's an issue. You agree?
Can I complement?
Yes.
I do agree to say that endodontic medicine, that is kind of a new field, is emerging at the moment, based on what has already been done with periodontal medicine.
Yes.
And one of the issue, I think, is that I agree to say it's important, but it's difficult to say causation between our
That's true. It's still no
the
level of
strength
evidence high. Yeah, that's really important.
the
Yeah.
association. But when you take cardiovascular disease that are a large scale effect with 20 million deaths every year, even if it's just a modest modifying risk factor, it's also important.
If we help to save lives in any way, it's good. You know. Yeah.
Yes. So for both of you, yes. So can we already say that root canal treatment improves overall health, or are we still on seeing just like association? Not yet.
So we were waiting for that result for a very long time, you know. And when we are talking about some specific topic, I'd like to talk about the highest level of evidence. We published that paper, which give us a proof that there is significant reduction on many studies included that we can prevent the development of low-grade inflammation when we perform high-quality root canal treatment. So that's the catch. If we are working, you know, we always could discuss potentially about focal theory and not focal theory, how it's actual.
I will come
Yeah,
to that.
how it's actual or how it's not.
Yes.
But at this moment, we have a proof, evidence-based proof, at a high level of evidence that what if we are doing appropriate root canal treatment with the correct follow-up, clinical and radiographic evaluation, we could prevent increasement of low-grade inflammation. And when you are talking about causality, I always like to refer to colleagues to periodontology, you know, because they have, it's easier for them to perform long-scale studies, you know, they could evaluate it easier. They don't need to have follow-up continuously, like 4 years, 5 years, 6 years. They saw their effect of their therapy in a short period, and they already have a great results regarding the decreasing level of these mediators after actually providing just a causal periodontal therapy. So that's the catch. We are in relation to perio, so it's important to stress that as well. Yeah.
Anything to add?
No, I think you did it very well.
Yes. So, Alexander, your review combined many smaller studies, yes?
Yes.
What kind of evidence is still missing before the wider medical community accept this link? Or not?
See,
or everything is
from the perspective of researcher and person who are working at university, I think you can agree with me. We need, in endo, we need more primary studies that are high quality. It is very hard to accomplish. I must agree with that. And we were discussing that issue at the research committee about these hot topics, you know, how to perform it, how to do that. We need to encourage young scientists, bright young scientists, to tell exactly what we need in such areas to prove. So much more high quality primary studies are needed just to confirm the observation that we already have, because validation and repetition is two very important aspects of any scientific approval, if you agree with me. Yeah.
Totally agree. And just we are in the process of discovering many common or shared pathway with same mediators between, for instance, apical periodontitis and some autoimmune disease. So we are in the process of discovering sometimes. And so we can think of contributing to autoimmune priming. So these concepts are quite new. So it's the beginning, I think, of the endodontic medicine.
Yeah. So, where do you see the most promising future investigations? Heart disease, autoimmune disorders, or something else?
Uh, so if we take a big picture of the situation at the moment, we have I'm talking about
Yes.
association between endodontic disease and so many systemic health conditions that could be mental health disorders, could be adverse pregnancy outcomes, could be chronic kidney disease. So the thing is that for each specific situation, the question we want to ask could be a little bit different. So I just think that it's a wide open field for research.
Great. Both. Question to you both. As clinicians, because you already
Yeah.
also working, yes. Can we tell patients that endodontic treatment is not only for saving teeth, but also reduces a hidden inflammatory in the body? Or is that message too early? Can we, as
No,
yeah,
it cannot be early. I think that we need it even before. You know, we need it even before to convince our patients and our society that we need to have health mouth.
yes,
Yeah, prevention is. I always say I am working privately, not at university. My department is for pathophysiology, but I always say I would give all money of world if I could do only preventive things in office, not dealing with so stressful situation. The
complicated, yes.
kids, a lovely,
Yeah.
beautiful mouth, healthy. So now, if we from the beginning of their life telling them that is important, it's basic.
Yes.
Those are basics, if you agree. Yeah, yeah.
I have a comment regarding that because
Yes.
I think we could have two type of patient: the one we receive in our office and the general audience.
Yes.
For the one who receive, they are really aware. I mean, in my opinion, in my experience, sorry,
Yes.
they are afraid about the lesion. For them, it's a hole in the body, a hole in the bone, and they are really asking questions. So there's no need for me to convince for this.
Them.
However, at the level of the general population, there is a need for prevention messages for that. So in the meantime, first we have to reassure patient about the potential of endodontic treatment, endodontic as a specialty, endontology in general sense. And at the level of the general population, we have to encourage them. Prevention is important. So
Absolutely agree.
Not about endo problems. I'm also now talking about oral cancers, perio issues. Oral health is important part of a general
the
health.
list is quite long.
Yeah. That's important. Yeah.
So I'm coming to that focal infection theory. So a century ago, almost a century ago, the focal infection theory claimed that oral infection could cause disease throughout the body. All body, yes. That idea led to many unnecessary tooth extractions, yes,
That's the problem.
before it was discredited. Today, new evidence again suggests important link between endodontic infection and systematic health. How we can, how to say, we have to take a responsibility to communicate this message very clearly and very understandable for the patients and clinicians as well. So,
Yeah. Would you like first?
No, start
I
and then I
see.
will complete.
I don't know why we are afraid of tear infection. You know, we are teaching our students that focalosis or focal tear infection is a part of chronic inflammation. So it's already well known, written in the books. You know, and unfortunately, we have some focuses in oral mouth that will potentially could spread factor of virulence or bacteria or mediators into the different parts of our bodies. And it's already explained what the biggest problem. I talked yesterday with Professor O. Peters from Australia.
Yes.
We were talking. He said to me, you know, Alex, you should be very conscious when you're talking about focal infection. Yes, I agree with you, but with the explaining of mechanisms, we will not propose to extract teeth. We will propose to treat the teeth appropriately, and we now have a proof that if we do that appropriately, the level of mediators actually that are beyond the focal infection will reduce, will gone. We will help by treating, The treatment option is not an extraction. We have clear indications and clear contraindications. So when I'm talking about focal infection as a concept in a medicine, I'm talking about any other pathophysiological mechanism that is happening. It's not something that we have to, be scared. But Ovi told me, and I agree with him, we need to find a way how to approach with our way of opinion to patients and to colleagues. Yes, to colleagues, to share our level of understanding of these issues, because
and possibility of modern endodontics.
Yes, that's my opinion. So I'm not afraid about it. Yeah.
To add something, we have better knowledge about the mechanism. We have hypotheses that needs to be infirmed or confirmed, but also the patient are not the same because the consequences for healthy patient is totally different for immunosuppressed patients. We are deeper in the knowledge now than we were before. So.
Yeah. Unfortunately, this is a situation that happens even now in Lithuania, for example, my country. There is still misunderstanding, or how to say, because patient depends on our opinion. I think as a practitioners, we should understand. We should teach our colleagues to bring the correct message.
And see, regarding the opinion of leading society in world of endo, ESC, I need to say that the Health Benefit Committee, led by Professor Frenson, just actually started a few months ago with a positional statement that will be published hopefully soon. We are 8 very good clinicians and scientists are working on it. And I hope that we're gonna finally have some recommendation that will be as official, statement of a very highly trusted organization like ISAR, that we could say to patients, stakeholders, anyone who is interested about the current state of the art. It is important,
This is the, how to say, responsibility of our committee, Benefits of Endodontics. It was, I think, built based on that. Yeah. Alexander, looking ahead 10 years, what would an ideal integration between dentistry and medicine look like if your research pathway continues?
See, I consider myself as a dreamer, I like to have brilliant dreams. Maybe they won't become true, but no one can stop us to dream, We could dream bright future, etc. I believe, and I hope I will be able to reach that with my years, experience, and everything. I hope that personalized dentistry is the future. We already have personalized medicine in so many aspects. And I know that it is potentially a problem because so many things needs to be revealed and included. And from the aspects of earning money, it's not something in this moment interesting. But when I was dreaming that, I was trying to put myself in the position of patient. It would be good that I can come in office and that my physician could tell me, Alex, you have predisposition for this, and this, based on analysis of your omics situation, analysis of your current situation. You need to take care about this, and this. And also, regarding some situation in mouth, the predictability of having or development of this situation will be like that. So we will have more comprehensive analysis what could be happen with our some treated or not treated situation. So personalized medicine is a big issue in the medicine. And in dentistry, it's just knocking on doors and just start to open a little bit in endo. And I hope that in next 20 years, we will have specific chairside tests for pulpal diagnosis, for genetical predisposition, susceptibility to some diseases in endo. So I hope that we could watch this movie in 20 years and tell what will be what's happened and what we're going to reach in 2 centuries, in 2 decades.
Yeah, to make just a shorter answer, I guess that in the next future, 20 years is quite long. Let's say 10 years.
But give us a chance. Give us a chance.
10 years for me is first better integration of the data at first level. The second, and you mentioned, I think we will have better biomarkers from maybe saliva,
Yes.
genetic ones that will help to know whether the patient are prone to heal or not. And I think that the third point, my last point, will be the integration of the artificial intelligence
Yes.
to stratify risk or to have a better criteria decision process.
There is
That's
a lot
how
of
what
potential.
I
Yeah.
see
Predictive models, that's the future. Could not be done without it. I agree.
my 3 points, I would say.
Yeah, and just to wrap it, everything summarize, should there be an awareness campaign to involve medical doctors so they see endodontics as part of systemic health care?
It's a crucial point. We have to discuss, collaborate with our colleagues, the physicians. So the thing is how to make the awareness campaign, as you mentioned.
Yes.
From my experience, what we did, but just locally, we organized some joint meetings with physicians, cardiologists, and physicians to discuss the new recommendation we have had in France, to know whether they knew the recommendation, they would apply the recommendation, and it was a first try of crosstalk between ourselves. So I think it's the first step, and the next step would be to have this at national level and then at the European level, as that's where the ESC comes into play for this. But awareness campaign is strategic, needs time and money also. So
For sure.
I can tell about the situation in Serbia because I know when some of our friends or parents go to the physician, they're already telling them, for example, that diabetes is, how to say that, oral diseases, gum diseases, perio, is a seventh complication, potential complication of diabetes, which is really important so that they also could be aware of the link between mechanisms, you know, and to try to lower it down on the simplest way, you know, you just need to take care about your oral hygiene. Oral hygiene in the center of oral health and the prevention of many other diseases. It's not complicated. It's so simple,
Basic.
so basic. Yeah. Back to the roots, actually.
Back to
Yeah,
the
back
roots.
to the roots. Yeah, back to the roots. Yeah.
So that's all my questions on this very, I think, important topic. Thank you very much for being here.
thank you, Laura.
Thank you for inviting us.
For contributing ESC and contributing our specialty and our community. Thanks a lot. And now I just want to say that stay tuned because we will have few more interviews with the poster winners and award winners, and also our presidents. Thanks a lot.
Thank you so much.
My pleasure.
See you soon.
Thank you.